You have been prescribed an aerosol inhaler. This information will provide you with explanation on how to use the device and practical tips to ensure you receive optimal care. These instructions should complement that provided from your doctor, pharmacist, or nurse. Before we begin, please ensure you have your inhaler in your hand and any instructions that come with the product. Certain inhalers may look different, and you should follow specific instructions. This information is for aerosol inhalers, which require you to press the canister. It is important that you follow the steps to ensure you receive the correct amount of medicine into your lungs. First, take off the cap from the inhaler. Some inhalers have a dust cap that protects the mouthpiece. Put this to one side, but ensure this is replaced after use. Check that there is nothing in the inhaler mouthpiece that should not be there. Shake the inhaler well before using it. This ensures that the medication is properly mixed. Breathe out gently to empty your lungs as much as possible. Sit or stand up straight and slightly tilt your chin up. Hold the inhaler in an upright position with the mouthpiece at the bottom. Your fingers should be placed around the canister, and your thumb at the bottom of the inhaler. Place the mouthpiece between your teeth and close your lips tightly around it. Ensure a good seal to prevent the medication from escaping. Start inhaling slowly and deeply through your mouth. This should be done at the same time as pressing down on the canister to release the medication. The coordination of breathing in and pressing the canister is important for proper delivery. Once you have inhaled fully, hold your breath for about 10 seconds, or as long as comfortable, to allow the medication to reach deep into your lungs. If you've been prescribed a second puff, wait 30 seconds to a minute and shake the inhaler again, then repeat the same steps. When you have finished, replace the cap on the inhaler. Some multiple-dose inhalers have a dose counter to show you how many doses are left. If yours has one, it is important to check it before each use to ensure it is not empty. Once your inhaler is empty, please return your used inhaler to a community pharmacy for safe disposal. You may have been provided with a spacer to improve the delivery of medicine into your lungs. Spacer devices come in various types and sizes to fit the mouthpiece of your inhaler. These are easy to use and gives more time to inhale the medicine. Spacer devices also reduce the risk of side effects such as oral thrush when inhaling steroid inhalers. Follow the spacer instructions to ensure correct use and cleaning. Lastly, due to the risk of infection, do not share your inhaler or spacer device with another person or use someone's inhaler. If you have been prescribed an inhaler that contains steroids, it is advised to rinse your mouth with water and spit it out after inhaling the last dose, to reduce the chances of oral thrush, which sometimes happens with inhaled steroids. If you have been prescribed a high-dose steroid inhaler and are taking it regularly, then it is important that you also carry a steroid card. This lets other healthcare staff know you are receiving a high dose of steroid in case of an emergency. It is good practice to keep your inhaler clean to ensure it works correctly. To clean your inhaler, please take following steps. Remove the medication canister and cap from the mouthpiece. Do not wash the canister or immerse it in water. Run warm tap water through the top and bottom of the plastic mouthpiece for 30 to 60 seconds. Use a soft cloth to remove any crusting of medication around the pinhole in the plastic mouthpiece. Shake off excess water and allow the mouthpiece to dry completely. Overnight is recommended. If you need the inhaler before the mouthpiece is dry, shake off excess water, replace canister, and test spray 2 times away from the face. Store any inhaler currently in use at room temperature, away from moisture and heat. Do not leave the inhaler in areas where strong sun can heat up the canister. Always follow your doctor's advice. If you have further questions, consult your doctor or pharmacist for more information. Finally, please read the patient information leaflet which came with your inhaler.